Coffee with Coker is a healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
Welcome back to another episode of Coffee with Coker. My name is Mark Reiboldt. I'm the host of the podcast, and we thank everybody for listening. And we're going to jump right into today's discussion. I'm actually joined by a guest we've had on before, Jack Liu from ProCare Portal, which is an organization that Coker is closely aligned with. And we've had podcasts with Jack and his colleagues on before. And we have a new guest with us today, Dr. Hamlet Benyamin. Hamlet works closely with Jack and the ProCare team. And we're going to be talking today about one of the big initiatives he's working on and that they're working on together, which is called Precision Experience. And obviously, we're going to jump into that here in a minute. Before we do that, a couple of housekeeping items that I always like to cover. Once again, we thank people for listening, for subscribing and following us. This podcast, along with all of our podcasts, are available on the Coker website. You can find all of those at coffeewithcoker.com. Of course, you can find them on all the standard podcast applications as well. Also there at the Coker website, you can find all of our content, white papers, articles, blogs, etc. And subscribe to our weekly email newsletter that has a lot of very helpful information as it relates to kind of all things the business side of healthcare. So with that, I'll leave it there. I want to save our time to talk with Jack and Hamlet. As we're diving into this discussion, there's going to be a link available in the show notes of this podcast that will take you to a white paper that Hamlet wrote, and it's extremely informative and has a lot of deep background on what we're talking about today, which we'll only be able to cover relatively high level. So if you're interested, or if you'd like to learn more, that white paper is a really helpful source on what we're talking about and a little bit more detail. And then, of course, if you're further interested, I would highly recommend reaching out to Hamlet and Jack to learn more about the topic today. But with that, I want to jump right in. And I think the best place to start, maybe, Hamlet, is what is precision experience and what are you guys doing? What does it mean and why is it important?
Well, thanks for having me, Mark. I really appreciate being here. I think this is an exciting time, definitely. The statistic I like to give people is really taking a look at when we started sequencing the human genome, which was back in 1990. And this was an international project. Back then, it cost about $2.7 billion over the course of 13 years to sequence 90% of the genome. And now there are companies that can do this for about $1,300. And if you take a look at the parts of the gene that actually code proteins, that's about 2% of the genes. The genome, it's about $300 to $600. So that right there should tell you that it's become more economically feasible to use this as a way to help guide therapy, to come up with medications that will be used to treat patients with their diseases. And really the shift is a shift in a paradigm where for the last 20 years or so, our focus has been treating people under the umbrella of evidence-based care. And evidence, of course, is very important. But the problem has been that our care for people has been a one-size-fits-all approach. And what we're shifting towards is really specializing on what are those genes for that individual doing throughout the course of their lifetime, and how can we better assess that so we can develop therapy and care and guidance that are individualized to that person. So that's the promise of precision medicine. And precision health is really that plus its other component, which is the experience that we give people. So I call that precision experience, the experience that people need as they're entering the healthcare force. And that experience may be a parent that's picking up their kids for a soccer game, but needs to get the blood draw before they go there. And they want that to happen quickly, effortlessly, and really without any friction. The opposite would be someone who's in the hospital, families there wanting to have a conversation with the care team, the physicians, the nurses, and really wants to have a very memorable experience, really a shared experience about what are we doing moving forward, you know? So we really want to individualize that care This time is exciting because now I think we all realize that this can't be done without paying recognition and understanding how that experience also should be for the workforce. Okay, physicians and nurses. So really what we're talking about here is looking at how we can remove barriers, how we can improve our processes, how we can really kind of assess where the workforce is throughout all this so we can better, deliver that care for everybody.
Yeah, that's really helpful. And I think this is interesting because for many reasons, but one of the things that jumped out to me when you were talking there was the challenges, let's just say, that the healthcare industry has had, whether it's workforce or performance improvement or process management, whatever it may be, are not new, and they didn't emerge necessarily just because or as a result of COVID. However, we saw the acute impact that COVID had on the healthcare delivery process, particularly the dynamic between the patient and the provider, the workforce dynamic that really evolved through COVID and shined a light on a lot of issues that were probably already there, certainly already there for some of these issues, but just grew and the level of acuity, I guess, through COVID. And so I'm curious, I think this workforce dynamic is something that I know from Coker's standpoint, we've done more and more work with our clients on, whether it's dealing with shortages or not even just shortages, which I think are still an issue, but just the efficiencies in our workforce and the processes that are behind it. And so I'm curious if you don't mind talking about some of the issues that you guys are seeing, you as a physician, Jack, obviously you as a company that works closely with healthcare organizations, particularly on its workforce dynamics. What are some of those issues that we're seeing out there right now?
Sure, Mark, I can chime in on what we've seen in the workforce. So precision experience as it applies to the workforce is not only applicable to doctors and nurses and clinicians, but equally as important, also the supporting administrative staff of those clinicians. And what we've seen at ProCare is, from a compensation perspective, there's a lot of challenges, especially with clinical integration and with the advent of value-based care and value-based payments, that it's become a very burdensome and onerous task for the administrative teams to calculate and deliver compensation. And so from the perspective of workforce experiences, it's not only introducing positive experiences, but also negating negative experiences, I think, is equally as important. And, the beachhead that we've started out on is in compensation. And we've seen a lot of different negative experiences that have come out of either inaccurate payments, untimely payments. And all of this contributes to that precision experience from both an administrative perspective as well as the provider's perspective.
Gotcha. So, and I should probably clarify here for folks that may not be aware, but ProCare, what you guys do, it's technology that provides automation and compensation, incentives, benefits, all that stuff that is key for particularly provider compensation, and which, needless to say, has a very keen connection when it comes to workforce and workforce culture and the impact of some of these changes. So I'd like to hear about how precision experience is taking or working towards improvements or solutions that would provide opportunity when it comes to workforce culture and dealing with some of the risks that have emerged and have come about. I know, Hamlet, you talk about this a good deal in the white paper as we kind of are post-COVID here, and some of the lingering effects, but some of the potential opportunities as well. Can you speak to some of those things?
I think that, we should look at COVID as a tragic thing that's happened to so many people across the world. And when I wrote the paper, I wanted to make sure that we also looked at it as a jumping point from where we can, leap forward with healthcare. Because a quote that really struck me was John F. Kennedy in 1959, when he was talking about educational disparities. He said that when you look at crisis in Chinese, the characters actually composed of two characters. One represents danger and one represents opportunity. And I thought that was perfect. We're talking about how COVID was such a danger to so many people, but it was also a time for leadership to look at it as an opportunity about what is it that we can do better. This is the most challenging time we can really see in healthcare for the last easily 50 years. How we can look at this as a way to transform what we're doing, so that way, as we move forward, we can not only deal with crises like these in the future better, but we can just take care of people better. So I thought that was a good message to start off with. Kind of building on that, one of the key things here is making the workforce better. And when I say that, I mean that we don't want the workforce leaking out into other industries and leaving what they loved to do, which was take care of patients, and entering this industry with really a lot of motivation. And I think part of that over time is that motivation becomes decayed because of things that we put in people's way between the nurse and physician and the care of the patient. If you ask any physician what they want to do, they're very quick to tell you they just want to take care of patients. They want to help these people get better. And that's a very obvious thing. But I think the system over time has built enough things in there where we've created barriers, other things to do. Some people have called these hassle factors or pebbles in my shoe. And this is one thing we should look at removing, which is, to Jack's point, is that we're not only talking about building a specific experience, we're also talking about removing a negative experience. And talking about building a positive experience, that's a very complex thing. But one thing that I landed on was just this concept of flow, that feeling that people have where they feel like they're performing their best, and they are actually doing their best. And you get not only great outcomes, but you have a sense of wellness in that person that brings them back to their job, brings them back to that hospital or clinic, and repeat this day in and day out. And that's really ultimately the state we want people to get to.
The state of flow that you talk about, Hamlet, I like to draw the analogy to professional elite athletes where they're in the zone. That's kind of the same state or mindset that you're talking about, right?
Yeah, absolutely. I mean, that's where it started with. This is this is seminal work done by a behavioral psychologist. I think he was at the University of Chicago by the name of Csikszentmihalyi Mihai. And he looked at what are those metrics that seem to promote that state that people have, where it's that surgeon who's in the operating room and that feeling that they have operating on that patient as part of that team brings them back day in and day out. And as you can imagine, sometimes that operation can be very high stakes. It may not necessarily be something elective, but it may be something where someone's life is on the line. So how do you create that kind of experience for everybody within the system where we know we're dealing with a high stakes environment, we know we're dealing with people's lives, but we want to come back on a day-to-day basis so we can provide that care and we feel great about doing it.
Yeah, and I think that state of flow is really important. In fact, you speak of the high stakes, high performance surgeon, but even from an administrative, team's perspective, they can also get into the state of flow where it's really just the alignment, I think, between skill set and goals, right? If we have incremental achievable goals and they continue to achieve those goals, the byproduct of that is getting into the state of flow. I don't think the goal is to get into the state of flow. Another analogy I like to use is in my golf game. If I'm making good contact with the ball, if I am hitting fairways, if I'm hitting greens in regulation, those incremental goals puts me in a state of flow. Doesn't often happen to me in the course, but the point is, I think in creating this precision experience, these goals have to be personalized and custom tailored to each resource. And certainly that takes, policy changes from the top down. It takes check-ins on a routine cadence. There has to be a systematic methodology in place to curate this type of experience, correct?
Yeah.
I think if we look at the future of healthcare, like I mentioned earlier, if we're talking about precision health, which is this promise that we're going to give every person the care that that person needs, and we know that that care is a result of medicines and therapy, so we'll put that under the label of precision medicine, but it's also under the experience you give somebody, right? People want different kinds of experience. They need different kinds of experience. People are in different parts of their life. They have different responsibilities. But we want to also shed light on that experience also being a experience for the provider, the providers, the workforce, the people delivering the care. We know there's been plenty of research that people will add value to the system when they feel like they're valued. When the customer of a certain industry or firm will recognize that value, but it comes from within. And the most valuable resource that we have in healthcare is not the MRI scanner, it's not the medicine even. It's the person who has to make the decision, at what point should I give that medicine? At what point does that person need that MRI? It's that decision making that happens, and that actual delivery of, that touch point where someone's putting their hand on somebody and saying, I'm here to help you. Here's the medicine I think that might help you, or here's the care that you need. That interaction is very important. And whatever we can do to promote that and remove those barriers with that connection is super important.
Yeah, that's a good point. Now, I wanted to ask you about that, Hamlet, because in the white paper, you talk about individualized healthcare. And to your earlier points about how we've done a lot of things collectively to, quite frankly, make the system more clunky than it needs to be, or we've caused a lot of these things that get in the way of that efficient and effective patient-provider dynamic and experience. And I was thinking about when you were talking about flow. I think, Jack, you kind of alluded to the point, and you're absolutely right about it's not just the clinician and the patient dynamic, but the entire dynamic surrounding them of the organization itself, right? And this is, one of the things Coker does. I mean, we are a performance improvement company. That is what we do. And looking at trying to achieve some sort of state of flow, I obviously it's different. The individual state of flow versus an organizational state of flow, but it is very analogous. So that's one of the things that we like to work towards, because the more you can achieve that on the organizational operational side, in my opinion, what we've seen, and I think the evidence shows, the more effective we can get towards that clinician and patient dynamic. And Hamlet, you talk about in the white paper this individualized approach. Healthcare is not one shoe fits all, and you tie that though to what precision health is versus precision medicine. And so if you don't mind, talk about that, the differences in precision health versus precision medicine. And then if you can, make that connection back to how we can get closer to this individualized approach towards managing healthcare.
Sure. Yeah. So let me call out this diagram that I put into the paper, which is just this idea. If you have on the x-axis skills and on the y-axis challenge, right? If the skills are really high, but the challenge is really low, you put people in this sense of boredom, where what we're asking of them doesn't really kind of meet their goals of performing. It drives down their interest, and we expect that to really kind of pull them away from performing well and really wanting to be there for practical purposes. And the opposite of that is when the challenge is high and the skills don't quite match up, and you build a sense of anxiety for people. So leaders, we expect, and this is something that really actually leaders do well, which is kind of look at this state of uncertainty to try to figure out what makes sense for that person, right? So if you can align where the skills and the challenge is right where they need to be, you're at that state where we expect people to perform their best. Okay, so that's kind of our ask, is to kind of look at how you can develop a process as you're looking at what people are doing in your system where you're achieving that state. Now, how do you go about doing that? Obviously, that's individualized to not only just that person, but that whole process of care there, and where they are. We have care that's being delivered in clinics, hospitals, we have preventive care. So really the needs are different throughout. So, but if the focus is not on that, then we don't expect that the outcomes will be there, because the people delivering the care are not highly motivated. And when you look at performance, it's performance for people is really that motivation times skill. Okay? You want both to be there. You want the skill to be there. You want the motivation the motivation level to be there. Some people will actually go as far as saying, when I'm hiring people, and I'm actually looking at what is their level of motivation, because I can teach the skill, right? So anyway, kind of going back to, precision health, again, I think the confusion has been over the last, I would say, few years now. Precision health and precision medicine have been interchangeably used. That, we can develop a medicine that tailors the care to people, and that's precision health as well. What I'm saying is that you cannot expect to have great outcomes, align providers with value-based care, remove the anxiety that comes with that if you don't focus on the experience as well. So really precision health and focusing on individualizing care for patients and delivering great outcomes, aligning providers with value-based care has to be the experience component as well, precision experience. And so that's really what we're asking here, is to shine the spotlight on that. Businesses know that the customer experience is super important. But what we're saying now is that healthcare is recognizing that the employee experience is super important as well. So I put that together under precision experience as both complements that we need to look at if we're to deliver, what we want out of the future of healthcare.
Yeah, and what I like is you talk about in the white paper and even the comments you were just making about value-based care, and as we continue towards a system that, while we all agree fee-for-service isn't going completely away anytime soon, we are moving towards a more value-based care model. And I think certainly the clients we work with, hospitals and health systems, are absolutely moving in that direction. Some slower than others, but still that's kind of the direction things are moving. But the key there, and it's an increased risk model. And if you're going to effectively manage and mitigate that risk, that increased risk, what we're talking about here is an essential piece to that. Again, I alluded to Coker, what we do on the performance improvement side. Well, this ties directly into that, because needless to say, we all know workforce is critical here. So I like the connection there, but I think what we're talking about, I just want to put it kind of in brass tacks, is this is a solution or this is an approach for organizations that are adopting more value-based models, increased risk models, whatever you want to call it. And if you're going to get that right, or if you want to truly mitigate as much of that risk as possible, these are the types of things this precision health model is, and the precision experience, specifically what you guys are talking about, is going to be essential to that. Would you agree?
Yeah, absolutely, Mark. I think if we look at where we want to be, and between now and then being a road, right? Along that road, we can already see the signpost. The signpost of the Payvider is an example of this, because you can see now that the provider, the hospital systems, the integrated delivery networks, they're wanting to also be part of that payer source. They want to take on that risk. And similarly, the payers want to also be part of delivering the care as well. So I think this is a good sign that the industry is recognizing that we need to be, moving towards value-based care faster. We want to accelerate this, because physicians know that that fee-for-service is not the solution anymore. We need to understand how we can keep physicians connected to their patients, remove the barriers, enhance the experience. We all understand that. But at the end of the day, it's the outcomes that we're looking for here. We want the best outcomes and get the best value at the lowest cost, And so how do we do that? And I think the industry leadership and like I said, this emergence of the payvider is a good signpost. It's a good sign that people are willing to put in the resources, take on that risk, and also recognizing that they feel like they have the system in place, that they have something that can provide that value, and they're willing to move towards that and really show everybody else that they can do this.
Absolutely.
I read something really interesting along kind of that topic. And Hamlet, you talk about having a shared vision and mission across the experience of the providers as well as the experience of the patient, and really positive, one begets the other. Positive experiences from a provider's perspective allows them to deliver a better experience for the patient. And
I read an interesting article recently from Becker's. It talks about the patient's experience, and historically, hospitals and health systems, they like to collect patient satisfaction data, like patients' likelihood to recommend. And it was interesting to me that in this article, I think it was the Cleveland Clinic that did away with all of those metrics, and they only looked at one particular metric, which is plan of care visits, which is providers and nurses collaborating and coming together to the patient's bedside. And if you unpack that, I think that really is talking about a lot of the things that we've highlighted here, where team collaboration, team-based work really elevates the clinician's experience as individuals, as a team, and they're able to deliver a better experience for the patient.
So I like that direction because you're absolutely right, Jack. Typically, listen, we've been doing, as an industry, patient satisfaction follow-up for, certainly nothing new, right? And I think, though, this is definitely shining some light on how some of those metrics may be either off or misleading or doesn't necessarily represent the full picture or story. And Hamlet, one of the things, again, going back to the white paper that you talk about is you call it this payvider dynamic, and you alluded to it a minute ago. But I like the idea of connecting this to being able to make value-based care successful, and that's where I feel like precision health comes in. One of the last things you comment on in the white paper is, I'm quoting here, precision health paradigm will be successful when technologies of precision medicine are joined with the steadfast design of precision experience. What does that mean? And if maybe what I'd like you to do is kind of bring it full circle back to the precision experience, and where ultimately, our listeners and the people out there in the industry can go to start working towards this.
Let me share this thing that we've all heard before, where companies love to promote that they're customer obsessed, right? Customer obsessed.
Right.
Well, you can be customer obsessed and you can be workforce oblivious at the same time. That's not where we want to be. We want to be customer obsessed, and we want to acknowledge the role of the workforce while we do that. And that's really the point there. If our promise to people is that healthcare will move towards individualizing the care of the patient and giving the experience that they need, giving them the medicines that they need that are really tailored for them, you can't avoid acknowledging what is the role of the workforce there, right? The point that Jack is getting at is actually an extremely, extremely important point, which is many physicians, when asked, how could you take care of your patient without the support that you have, will tell you that they can't. They cannot provide care to that patient without the help of the nurse. without that pharmacist getting the medicine, without that tech bringing that x-ray machine to take the x-ray, without that pathologist reviewing that biopsy and telling you if your patient has cancer or not, the idea of the hero provider is gone. The hero being a person who is doing it alone is not what we want. We want to work towards acknowledging that the best way to deliver care to our patients is as a team. It's a team approach, right? And if we take that back to what we're talking about here, the team also includes leadership. Leadership is making those complex decisions about, where are we going to be a year from now? What is it that we don't know that we need to know and focus on to drive our system in a positive direction? So I like the definition of leadership being people that are good at dealing with ambiguity, complexity, uncertainty, driving change, right? And that's part of what we're talking about here. We have to talk about the change in this paradigm, which is that let's move forward acknowledging that we know the importance of delivering value to our patients. We know the importance of delivering the care that person needs as opposed to the person next door. But at the same time, we need to know that we can't do that without focusing on our most valuable resource in healthcare, which is the people that are there. And so that's the idea here, is that recognition and that assessment will eventually lead to implementing something that makes sense. And that's being purposeful about it. So you have the technology of the precision medicine, which is what many academics are working on across the country. I mean, all you have to do is take a second to Google precision medicine and you'll see centers at Cleveland Clinic, Mayo, Stanford, Columbia, just across the country that the academic medicine is placing research and dollars into that promise. But that will have not enough value to drive what people are wanting. Their expectations of their care needs to be also focusing on their experience. And doing that without acknowledging the workforce will be really deficient. It just will not accomplish our ultimate goal of delivering high value care. So I think that was ultimately where I wanted to circle back to in this paper, which is ultimately here where we're talking about, driving value forward.
Yeah. And I think sometimes when, we're consultants, right? And ProCare is a technology company. And I feel like sometimes when people hear us talking about value-based care and kind of this future model, it's treated like it's kind of theoretical, right? Or it's, great in concept, but that's more for the consultants and the academics and all of that. But I think that the point here, and let me be perfectly clear with folks, this isn't a Coker thing. And this is something that we believe in and want to highlight because of its value and how critical it is to my earlier points about if you're going to take on more risk-based models, because again, that's what they are, then these dots must be connected and they have to be improved upon. And a lot of organizations struggle with that. And it's not just the major academic institutions or major health systems. They're not the only ones that can make this work. This is something that can work all the way down to, the rural medical center or the clinically integrated network across different regions, whatever it may be. And I think connecting those dots is going to be important for any organization that's looking and considering these models, because they ultimately will be forced to consider them. But bringing it down to kind of the bottom line, if people are hearing this or they're reading this white paper, what's a good kind of initial step towards working towards this enhanced precision experience? Where do they need to go? What's the first kind of, where do you start taking bites out of this particular elephant here?
Yeah, I mean, I think anytime we're driving change, it always begins with assessing where you are, right? Every institution needs to take a look at where is their workforce. I mean, something like getting an idea of the sense of wellness for people. Are they accomplishing their goals? This is where it really begins. I mean, people can look at multiple inventories to kind of assess that. And Maslach is one of the most common there that people use, but I think the idea here is going to be aligning the providers and leaders together and asking them, what are you trying to accomplish here that you don't feel like you are on both ends? That's the true partnership there. So assessing that as, I think, the first step, and then from there you will gain better insight on how we can individualize that experience for those people.
Absolutely. As I said earlier, what we've talked about today literally only kind of grazes the surface of this as a concept and what you all are doing and talking about when it comes to the precision experience. So I really want to encourage folks to learn more, to dig deeper into this. Again, the white paper is, has a lot of really helpful background or deeper commentary related to what we're talking about and what y'all are doing. But, I really encourage folks to follow what you guys are going to continue to be talking about in this realm. And I should have mentioned this when we started, but I know, Jack, you guys, ProCare, y'all are doing a series of webinars where you are talking more about this and can dig in deeper into some of the different components of it, answer questions, things like that, where again, we can really start to dig deeper and digest what we're talking about. Because I do think where a lot of organizations out there are struggling with is where to start with this. It's not a short-term project to work on. This is going to be something that requires ongoing attention and evolution as you work through the process along the way. So I really want to encourage people to investigate that further. And at the end of the day, like I said when we started, I would recommend anybody who's interested, just reach out to you guys, have a conversation, because again, we could probably go on talking about what all of this means and what it looks like or should look like all day long. But there's going to be a lot here, and I know there's going to be more to come. So I appreciate you guys at least coming on and briefly talking about this from a high level. And again, we'll make sure everybody has the white paper links and your contact information so they can learn more.
Absolutely. Thanks for having us, Mark.
Thank you very much.
All right. Thank you.
We hope you enjoyed that episode of Coffee with Coker, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter at Coker Group, and then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback. And we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.